So,
what's going on with you?
My neck flares up. I think I heard it 8 to 10 years ago.
Weightlifting,
real sharp. I don't know, it's burning, kind of in my trap. Littlest things now just flared up, like just taking a deep breath and then just sharp pain in my neck, limited range of motion, just kind of discomfort all the time.
All right, let me take a look at you. Eyes are supposed to be level to the horizon. The base of the skull is shaped like a sphere. The top of your cervical spine at C2 is shaped like a sphere as well. What marries your skull and cervical spine together is called the atlas vertebra. You'll have a whiplash, something will happen, you'll fall, and you'll have a slight displacement relative to each other. When that happens, your body is forced to twist and compensate. You want to have the neck and head and atlas in what we call orthogonal 90-degree relationships. I don't crack or pop, so I use this table that you're on right now based on the math that I get from the x-rays to prepare that head and neck back towards proper position, take the torque out, and release the atlas using that instrument, which is a sound wave. The longer you stay in proper alignment, this will feel better, that'll feel better, and a lot of other things work better because that's opened up. The leg should be even. When you're on your back like this, things should line up, but right now the right side's pulling up about 1/4 to 3/8 of an inch, which is a good sign that I can help you. Just a hair of left head tilt. Basically those muscles are pulling harder, so you've probably been out of alignment for a while. The base of the skull here, typically on the right side, there's a nerve that will inflame right there. You have the skull, atlas is in the soft spot. This is why your dad tells you don't ever hit anybody in the back of the head, because basically your brainstem sits in that soft spot. And then C2, your spine really starts like right there, just below the atlas and above C2. It inflames that nerve right there when it goes out. So I can definitely help you. Questions? Necklace is off, and then we'll get rolling, man. First thing that I notice is the lack of curvature through the mid to lower cervical spine, which points to a whiplash trauma. Sort of locking up in here and being tight and inflamed, that he's gonna have some decreased range of motion and pain as well. The amount of tilt in his cervical spine, it's nearly 3.5 degrees. The head itself is the weight of a bowling ball, so you're talking like 10 or 12 pounds. That weight is pushing down, and effectively his head and neck are buckled. So that's going to put a ton of pressure through those discs and nerve roots. If I bring up this little atlas model, looks kind of like that. It's a ring around the brainstem. You have the cervical spine coming up, then the atlas is sitting on top, and the skull is resting on top of the atlas here. But for him, the atlas is rotated left posteriorly about 2 degrees, which again is going to create a lot of pressure through there and tension for him. This image is what I will use primarily to adjust you with this information on it. You'll be on your side, actually in this room. I'll be opening that head and neck up. Your head will be on the headpiece. Your job is to just relax once we get rolling. And then I'm going to be lining the instrument up to that joint after I have influenced everybody back into proper alignment. So you will hear a click, you won't feel something necessarily crack or move, and then rest you for about 10 or 15 minutes before I would post x-ray with one of these from the front and then one from the top. Remember how that felt in there? Pretty cool, right?
Yeah.
So what's happened now is the atlas has been properly set underneath the skull. So there's no more irritation on that nerve root. Where that leg was short is even right now.
Yeah.
So you got a good release, man. How you feeling? How you doing?
Good.
How's your body behaving?
Good so far. Nothing seems to be out of whack. Yeah.
Good.
I feel like I'm sleeping better,
Right on.
honestly.
Like fever or longer or what?
Well, I usually wake up multiple times throughout the night. I'm actually making it
Right on.
pretty much almost the whole night
You
through.
would wake up from pain or just sort of
Just discomfort.
Like a fight or sleep? Okay.
Yeah.
Still
Yeah.
doing good? Think you're in?
I still think I'm in. Yesterday was a good test because we were in gear yesterday, and normally when I wore my helmet for even a short period of time or a long period of time, I was constantly having to move my head around just
In the past.
in the past. yesterday, though it was a short amount of time, maybe 20 minutes, it felt good. Like
Yeah,
I didn't
different
feel
experience, yeah.
like I didn't have to constantly like give my neck a break or take my helmet off, put it back on, and so
Awesome.
I want to be in gear more to test that. So that was a good little baby step.
Right on.
Yeah.
Cruising, dude.
Cool.
Yeah.
Awesome.